Let's get started. Today is all about promoting your MAT program. And we've talked about this before, but we thought it was time some of you, it'll be a refresher, and for some, it's the very first time. However, it's always worth reviewing because sometimes you may have missed something. So we're excited to bring it to you today. California Bridge is a program of Public Health Institute, and we do share our materials. We welcome you, and for the best experience, out of all of these key points, the number one is if you have a question, please type it in the chat, but make sure the blue box is addressed to everyone. If you have a question, people want to know what the question was and we will answer it, but make sure it's addressed to everyone. So that's always very helpful. And we are California Bridge. Our goal is 24/7 access to high quality treatment of substance use disorders in all California hospitals by 2025. We have 278 hospitals, and we are excited to share that news, and you are one of them. So we have a few announcements. First of all, I want to thank everyone for taking on our Navigator Challenge for Overdose Awareness Day. You flooded Slack with all the wonderful events at everything that was going on in the community, at your hospitals, and not many times I'm speechless. I was really left speechless. Our hearts here at Team California Bridge were filled with joy. It was just amazing to see all of your dedication, your motivation. It was so appreciated. You are making a difference, and it's obvious that you are a patient advocate in every sense of the word, and you are promoting change. So we are so proud of you guys and the awesome work you're doing. Here's just a few of the pictures we had taken from that day from all around California, including the event in Sacramento. So some of you joined us, and we're really excited that you did. Again, these were all in your hospitals, in your community, and we again appreciate all the hard work you're doing. And this is our last picture, and this is really sentimental to me. It just shows all of the representation of the lives lost to overdose death and the purple flags. And this is from San Diego, from Harrison. We're really glad she sent this. So another announcement, we have our in-person event Monday. If you're already signed up, we will be seeing you in LA at the Cal Endowment. It's not too late. And then next month will be our Navigator Focus Series, Behavioral Health and Substance Use Disorder Best Practices. So we have, again, some great information on working with dual diagnosis patients. These are our objectives today. And I'm really quickly going to talk about increasing your impact. These are some of our successful sites, and these are just a few, you guys. We know so many hospitals are doing wonderful, but we did want to highlight some that are just doing remarkable work. And so these are some of them, and congratulations if you are one of these. And if not, maybe next time. So always room for some more. So real quickly, before we get started, I wanted to go over some best practices that these successful sites are using. And it's about supportive clinical champion supervisor. If you do not have one, we know it's hard and difficult. Please contact us. We're here to help and strategize on how you can develop that relationship. Review your ED tracker. Remember all of those key tips in Sun Training 101. Consider screening on triage and intake. Huge push in patient encounters and referrals. Utilize electronic. I know some are still trying to implement this, but keep your efforts ongoing. And make rounds. Just be visible, you guys. Check in with whoever you can. Security, ED, charge nurses, and attend anything you can attend and be part of the team. Those are some of those successful strategies. So we just ask and take this challenge. How will you increase your impact? We gave you so many strategies, and if you need more help, let us know. But you're going to hear this term going around is just increasing your impact in your own hospital. And a key strategy is to give a presentation. So with that, I am going to hand it off to Chaya Vang. Chaya is our project engagement coordinator and mentor for Fresno. So hello, good morning, Chaya. Teach us how we can present to our hospital, our community.
Hi, good morning, everyone. Good morning, good morning. So I want to share some of my experience too from doing a presentation, but I will walk you guys through how to do step by step. But basically, when I first started my program, as many of you may already know, about 4 years ago, I thought I was prepared because I knew what I was talking about. But I went into like the shift reports just with some buttons and pens and my pamphlets, but that didn't seem enough. I because I didn't have a PowerPoint, and I've learned that having a PowerPoint is like having a cheat sheet like right in front of you, so you don't leave anything out. And always, if you have your clinical champion, ask them to be present because you will get so much more buy-in from your whole staff overall. Even when you do community outreach, people like hearing from an expert clinical aspect of this program. So there may be questions, just feel free to drop it in the chat. The slideshow that this presentation that we're going to show will be sent in a PDF form in a follow-up email. If you can't access it later on, please reach out to your IT because this is a template that you are going to want to use when you present your program. So today, we're going to go, like I said, step by step on how to prepare and deliver a presentation. And it's going to take time and practice. Like I said, I've been doing this for 4 years and I'm still practicing. So definitely, like step one, be prepared. Being prepared is the key for success when you are arranging for meetings that are going to have stakeholders. Promote your meetings. Be ready on the day of your event. Review and present your slide like over and over again. Review those slide decks, and then make sure you have some data and some stories to share, because we all know that our staff love hearing these stories, and it just makes them feel like they're part of the journey for our patients. And always remember to follow up, because people tend to forget too. Next slide. So step one, prepare for your presentation. Practice your presentation and time yourself. We recommend 10 to 15 minutes because we know there is time crunch when it comes to working in the hospital. Ask your supervisor for an existing meeting like shift huddles or monthly provider meetings. It's much easier when it's already scheduled and they just make little time for you. Or if a new meeting is needed, ask for a time that will work. And always, like I said, remember to have your champion present with you if possible. Next slide. Promoting your program is step two. So the more people that know about your meeting or your presentation, there's higher chances of higher attendance. So first of all, make a simple flyer if you can. Important information put on there: when, where, and what is the meeting topic. California Bridge, of course. And then post your flyer wherever you can. Doc boxes, nursing stations, bathroom, break rooms. You guys could drop in the chat where else you could drop these, post these flyers that your staff will be able to see. People can get creative. Send out emails. And then also send out reminders, maybe 2 days before the meeting, 1 or 2 days before the meeting, just so, like I said, the higher you want as many people there as possible. And then on the day of the event is step 3, be ready on that day. So we know how busy providers are, so remind your champion. I always have to remind my champion an hour before and then 5 minutes before the meeting. Are you going to be here? I'm sending him texts and he would always show up. Even though he's late, he'll show up. And then plan on arriving early, and that might mean don't take a consult the hour before this meeting starts, because we all know patient consults may take a little bit more than what we expect all the time. Uh, Set up your PowerPoint and make sure that it works. Make sure you bring flyers, business cards, whatever handouts you're going to pass out, have that ready in hand to give out to everybody that's going to be attending this meeting. So this is step 4 and 5. You're going to prepare and review your presentation. And then also part of your presentation, you want to share your data and your stories. So I'm going to time myself, so I know exactly how long this meeting, actual presentation is. And I'm now going to go into presentation mode as if you guys are my hospital staff. And I'm going to start presenting. So like I said, you guys will receive this PowerPoint later on, so you could put in your information. Starting my timer. Okay, so hi everyone. My name is Chaya Wang, and I am the Substance Use Navigator in the Emergency Department. I work with Dr. XYZ on the addiction team, who is my clinical champion. We are here to share about the Amazing Bridge project with you all. And you may also have heard us as the MAP program, Suboxone program, or Bridge. So that is us. So one of the things that's most important, one of the most important things is that is changing what we think about addiction and highlighting that addiction is not a moral failure. It is a chronic disease that requires medical treatment. So let's review how we got to this point in the opiate epidemic. We're going to start off with why we're doing this program. So you can see there are a few numbers on here, but I really want to draw attention to the 107,000 people plus that have died from overdose in 2021. The numbers are pretty similar in 2022. And it's likely that everyone here knows someone that may have been impacted by this. So the California Bridge model focuses on 3 pillars. The first pillar is low barrier to treatment. The second one is connection to care and community. And the last pillar is responsibility of everybody involved, the culture of harm reduction. So usually Dr. XYZ will be here to present this from a much more clinical aspect, but since he's kind of caught up in the ED right now, I'm going to explain the resources we have available for doctors and nurses to help understand buprenorphine administration. Low barrier to treatment is 24 hours, means 24 hours access to medication-assisted treatment such as buprenorphine, or also known as Suboxone. It is evidence-based, and there is a buprenorphine algorithm for guidance, and there are warm resources to help support the clinical team 24/7. So this slide here is evidence that starting buprenorphine in the ED works. Substance use, particularly opiate use disorder and overdose, is highly treatable when we can provide rapid evidence-based access. Dr. Gail D'Onofrio did a large study on patients who were started on treatment in the ED and compared it to patients who were only getting connected to ongoing care. The success rate was 78% for those who started treatment and stayed in treatment for 6 months, compared to the 37% that were only connected to treatment. So that's twice as many patients, 7 out of 10, that were successfully connected to treatment and stayed in treatment. So we know that there is like legitimate desire from patients to access treatment. And that starts with low barrier entry into the system, which starts in our ER. California Bridge has provided a step-by-step guide on how to start MAT buprenorphine. It's super easy to access, even on your phones. You can quickly access, scan this QR code. I also have handouts printed for you all today. Again, Dr. XYZ can provide the more clinical education and support as needed. It is a little bit cut off on this slide, but on the webpage, there are more resources available. Any provider seeking for support can contact the substance use lines. The poison control line is on there. It's 24 hours, 7 days. And then there's also a warm line that you could leave a voicemail if you're seeking specialty addiction medication consultation. This is the California Bridge model in action, and this is also our workflow. So our hospital here, we use the exact same approach. When patients come into the hospital, Dr. XYZ normally will provide the clinical assistance to providers and the staff to help support patients with the medication. Myself, the navigator, I can offer the patient resources and linkage to ongoing care and also follow-up. This model shows that when patients get evidence-based care, they have better outcomes, and together we lower readmission rates. When we talk about connection to care and community, it means that I am part of an effective workflow that helps me make the next level of connection with patients. As a navigator, I connect with patients with referrals. Sorry, I connect patients with referrals to treatment and give them a warm handoff. So also in my role as a navigator, I am the helper that can advocate for patients that are struggling with substance use and or with behavioral health needs. I will be there with patients during the journey to recovery. I have the capacity to build rapport with patients, learn what their needs are, assess them, navigating these resources in the community, and connect them to ongoing care. Again, I can see patients during the hospital stay, whether that's in the ED or admitted upstairs. Usually my encounters help fast track the patient care process. So even after discharge, I can help the patient along the way with the recovery needs just by following up. So my approach is very free from judgment and stigma. I'm actively contributing to the patient care process, and I have a close collaboration with the community and to provide a comprehensive list of resources if needed for our patients, playing a very vital role in restoring hope. I like to give an example here of my ongoing relationship with our county, doing county referrals. So whenever I have a patient that is interested in resources that are inpatient, I make direct calls to a specific contact person that I have established through the county's public access line. This patient and this person that I've been working with also sees patients in person for assessments of referral. Let's just call her Sam. So whenever Sam sees patients that are experiencing withdrawals with substance use, she calls me right away, and she'll send patients to the ER because she knows that I'm going to be there to walk the patients through, at least through registration, and help advocate for that patient to get the treatment that they need in the ER. So I have a question actually for our community partners. If anybody here in the audience, have you had any contact with a navigator, and what has that experience been? I hope it's been a positive one. We could go on to the next slide. So I see patients of all sorts, including pregnant patients, adolescents, patients with HIV, even patients who are not sure if they want to start treatment. I meet the patients where they're at, and my goal is to provide hope, even if that's just my contact information or a brief conversation. And this list here is just a different type of referrals that I normally offer when talking to my patients. So our last pillar is about culture change, and there are different parts of cultivating a harm reduction culture, but I'm going to focus on one for today and that everyone here can practice. So the great thing about culture change is that it is free, and we can all use our hearts to speak of kindness to patients and about patients who have substance use and behavioral health challenges. Together, we can make person first language as part of a norm around here. So an example would be, instead of saying drug addict, use a person who uses drugs. Instead of saying clean or dirty UDS, say positive for alcohol or positive for opiates. I've also brought printouts. The words matter campaign so everybody can take. The campaign can be found on the National Institute of Drug Abuse. And again, all the resources I'm sharing with you guys today will be provided in the follow-up email. So our hospital has been offered free trainings and technical assistance through California Bridge. So you might want to take out your phones and scan this QR code. It goes to our resources such as guidelines for BUP after overdose during pregnancy. There's free physician CMEs on there and CEUs for nursing through our Bridge Academy, which is available for free to everyone. So let's see how much time I have left. So I'm about 9 minutes and 40 seconds. So I have a few minutes to share a patient's story. So I'm going to share a story with all of you guys. You guys, everyone here in the ED obviously have heard of Casey. He comes through the ER frequently. And whenever he comes, everybody knows because everybody can hear him because he's just loud. So it did take quite a few times for Dr. XYZ and I to meet with him a few times. He's actually one of our very first buprenorphine patients. And that's when I got to see how buprenorphine actually works in person. And he totally changed. The whole, like everybody on that team saw that patient change. He was quiet, he was calm, cooperating. And that was probably like the one time he didn't leave AMA. Definitely he didn't change overnight, but we did work with him a lot. Dr. XYZ and I, we constantly we saw him in the ER. We constantly did referrals for him until I decided it wasn't gonna work with him because he was homeless. So I told him, let me go meet you at the clinic because calling and making the appointments wasn't working. So I went and met him at the appointment and he showed up for whatever reason before it didn't work, but this time he showed up and he got in. He saw the counselor, he saw the doctor, he's now on treatment. And the best thing is that he still calls me. I know that he is back home with his wife now. That's why we're seeing less of him here. If you guys haven't noticed, Casey doesn't come here as much anymore. So he's definitely like I said, a work in progress. It's been like 6 months with him. And I want you guys to share this story with you all because this is all a team effort. Like I didn't give him the meds. You guys were the ones giving him the meds and treating him. I just did a follow, make sure he got connected to care after this. So I wanted to share that story with you all here today. So that was a lot of information, but the key takeaway from this is that if you're going to remember anything at all, MAT improves patient care and workflow. The California Bridge model is evidence-based, and I am here to support patients with substance use disorder. This is my next slide. So this is going to be my contact information, Dr. XYZ. Please reach out to me or put in a Sun consult so I can help you support your patients, give patients better outcomes, reduce stigma, and reduce readmission rates, just like XYZ's. And don't forget to pick up the flyers with my contact number and resources on your way out. Okay, so that was roughly, I'm now done with that presentation. That was roughly 12 minutes and 51 seconds. I don't know if you guys can see that. So the final step is follow up with your audience. We do get busy, like I said, so make sure you follow up within a week. Send out those emails and with the resources that you promised or that you shared during your PowerPoint. Make sure your contact is on there and then share your resources. Check in, make rounds in the ER, like Sherry said earlier, attend shift totals, talk to everyone that you can, show up everywhere. Bring some sweets with you if you you're able to do that. I know the toys has shared over and over again, and that works for people. And be available and be ready to start sharing those calls. So please drop in the chat some tips that may have worked for you or didn't work for you. I believe I am done. I'm gonna pass it off to Latoya now to continue the next part of this training.
Thank you, Chaya. So most of you are familiar with the phrase story time when it comes to social media, right? Today, you'll learn some key pointers on storytelling. Next slide. You'll be able to perfect your pitch in no time and advocate for your role as a navigator to be a permanent part of the hospital budget. So you'll do this with the next slide. This pitch outline. In our pitch outline, we have here for you the introduction, a body, and a conclusion. These are the three components that will make up your outline for perfecting your pitch. We're going to start with the introduction. So with the introduction, you'll want to have something that really grabs your audience's attention. Your hook can be something visual, it can be a memory, it can be statistics, any sort of data point. You'll introduce yourself along with your role, the length of time you've been in your role, and what it is exactly that you do. Next, we'll highlight the main points we want our audience to know. This is where you truly showcase your impact on the patient, on the hospital personnel, and in the community. You'll use your data to help support your main points, and that's going to be the most effective way to just kind of back up and support whatever it is that you're saying to your audience. And the best thing for this is going to be the ROI calculator. The ROI calculator is specifically designed to support your pitch, to support your impact. Lastly, you're going to give a summary of 1 to 2 sentences of your main point, the main point that you want your audience to remember, and then you're going to close out your pitch with a call to action. So remember those key components when it comes to constructing your outline for your pitch. You absolutely want to do this in some sort of written form, either on the computer or good old fashioned on a piece of paper, so that you can make any adjustments and amendments as needed. I'm a huge fan of those brain maps that you put ideas all over and then kind of start to refine them in. Next slide. The most important thing I can tell you when it comes to perfecting your pitch is preparation. So know your main point, know your audience, be short and sweet. You don't want to be super long-winded. I definitely can tend to be. So this is very helpful for me to remember to shorten it up. And then the absolute most important is practice, practice, practice. I cannot stress enough how much practicing your pitch is super important. I've practiced for this presentation. I practice for every single speech and presentation that I do. When you don't practice, it tends to show. So practicing will help you feel more comfortable. It'll allow things to come off more authentic, and you'll be able to really kind of weed out exactly what you want your audience to hear. Believe in yourself and believe in your impact. So with that, I'm going to bring everything together that I just shared with you, with the outline for the introduction, the body, and the conclusion. I'm going to bring together my hook, my main points that I want the audience to hear, and then my call to action. And I'm going to give you an example of my pitch. All right, here we go. Casey was dubbed a frequent flyer, averaging 2 to 3 ED visits per month in the last 90 days. Their chief complaint was abdominal pain, vomiting, and sweating profusely, which required constant ultrasounds and blood work. And then those results yielded unremarkable results, costing valuable hospital resources. We all know the story of Casey in this hospital, right? Casey needed a different type of treatment and support than they were actually receiving. What if there was a way to reduce these ED visits by 95%? Would you believe it? Let me tell you how. So I'm LaToya. I'm the substance use navigator here at Sunshine Hospital. I've been here for 2 years. The main part of my job is to talk with patients who disclose substance use, and I connect them to ongoing care in the or community resources. And I do this with a warm handoff. That's a very important part of what I do. So back to Casey. By June, Casey's ED visits dramatically decreased. Our hospital did something new. What do you think that was? Surprise! Casey connected with me, the navigator, and had only one visit in that 90-day time span after the encounter with me. They went from 2 to 3 visits per month in the previous 90 days to 1 in the following 90-day time span. We were better equipped to understand and treat Casey's symptoms and support the clinical staff, all with the start of a warm handoff. My role as navigator has helped build confidence with the ED nurses, with the ED providers. Everyone feels more comfortable being able to treat patients with MAT, which is medication-assisted treatment. And it's increased the number of patients who are connected to evidence-based care. So during my time as navigator here at Sunshine Hospital, I've been able to connect 1,000 patients. I've been able to connect with and have encounters with 1,000 patients. Out of that 1,000 patients, 653 have accepted referral to treatment. That is an amazing number. Let me say that again. 653 patients have accepted referral to treatment. This is just one patient example with Casey out of many that we've helped here at Sunshine Hospital. Think of all the Caseys who could benefit from navigator support. Think about how this can impact patient lives and our ED, our whole hospital. Ultimately, the navigator saves money, saves resources, gives peace of mind to our staff, and saves lives. Sunshine Hospital is equipped right now with the Navigator program. But the reality is that funding is coming to a close, and we need to transition the Navigator role into a permanent part of the budget in the ED by 2024. Okay, end of pitch. So I'm confident that each one of you can use our Perfecting Your Pitch guide to advocate for the sustainability of your role. And you can do that, like I said, with support of the data. So next, you're going to hear from John from our data team, who will give you a refresher on the ROI calculator.
Hey everyone, I'm John Kaliko. I'm the Data and Evaluation Manager for Bridge. I'm going to be sharing screen. All right. Chaya, can you give me a thumbs up if you see the ROI calculator? Thank you. Great, thank you. You're the first person I saw. Okay, so like I said, I'm John. I'm the data and evaluator for Bridge. I'm the person behind the data email. If you've been contacting, if I've been contacting you or you've been contacting me. And today I'm here to really give a refresher and go over the ROI, return on investment calculator. So in Latoya's amazing pitch, by the way, she highlighted Casey at Sunshine Hospital. And, part of getting to that place of developing a great pitch is doing some of the back work here in this calculator to be able to feel confident in the numbers that you're going to talk about. So in the chat, we've already linked to the return on investment calculator. So bookmark this webpage just as a first step that we don't even put on here. Just bookmark this webpage because this is always going to be your sort of go-to place when it comes to the calculator. And this is really, where we have the instructions and everything here for filling out the information that you need and actually going through step-by-step of calculating the Navigator return on investment. So I'm really just going to spend a few minutes doing, a high-level overview of what or how to do this. I just want to quickly highlight that one of the first steps or pre-first steps is actually just creating a copy of the calculator itself. So when you get here, it says before you get started, you're going to click on the link to the ROI calculator. I've already done that here. And you're going to create a copy of this. The way you do this is you go to the top left corner here, you go to File, and you select Make a Copy. It's as simple as that, and then you'll be able to edit this on your own computer. If you do need an Excel version of this, just reach out to us at the data email and we can get that to you. The presentation format isn't as clean as it is on Google Sheets, but we definitely have a version of that we can send it to you. But just high level overview of the calculator and the instructions of what you have to do. The first thing you're going to want to do is find your success stories to highlight. So between Chaya and Latoya, they had already been talking about this patient, Casey, at Sunshine Hospital. And that's such a great example to think about patients where you've seen, or the navigators at your hospital have seen, where you've really found success in their stories. And so one of the metaphors we like to talk about with this is if an artist is preparing for a show at a gallery, they're not going to put all of their works out in the gallery. They're going to really select the best pieces or the most relevant pieces to highlight the theme or the work that they're trying to demonstrate. And so you also want to think about that when it comes to this setting of preparing information for the calculator. And so you're going to think of the success stories really where you've seen fewer visits over time compared to before. And so just a high level overview again, within this calculator, you'll be able to identify up to 5 individual patients, and you'll be able to input all of that information into the calculator. We have these steps written below here, which is the actual data collection worksheet, where you'll input the information. And then you'll also have these other sections here where you review their results. And also at the end of that, you'll have an analysis report. Again, this is all broken down in the actual web page here. We actually did a more in-depth webinar on this a couple of weeks ago where we recorded everything and explained really in depth all these different steps. And so I'm sure we can share that out as well. So you can really, if you have more questions that I can't cover right now, you'll be able to sort of look through that and also hear more about the ins and outs and the details of how to fill out this calculator. But like today is really focused on presenting your findings. So I do strongly suggest taking your time to really fill out the calculator to the best of your ability and be comfortable with the numbers, because that really sets you up for success when you get to step 4, which is presenting your findings, which is what we've been covering today. I'm actually going to pause here and I'm just doing a quick time check. Okay, I'm gonna actually stop sharing screen. I'm going to welcome Navigator Amanda, who is with the Providence system, who has used this calculator and done this pitch in the real world. And Amanda, we would love to sort of hear more from you about your experience with the ROI calculator and yeah, just sort of sharing your wisdom with the group here.
Hi, everyone. Thank you. Yeah, so I used the ROI calculator pretty soon after it was given to us by Bridge, and I had really good results with it. I would just recommend, I know some people might get intimidated by Excel. It's really easy to use. I just went in, I collect all my data on a separate spreadsheet. We all can think of the patients that we see quite regularly that maybe we haven't seen their faces as often recently. And I just put their information in. It does, like John was saying, it does all the calculations for you. The only kind of difficulty I ran into was my specific hospital has a sort of paywall up. So I'm not able to open it while I'm on site, but I just took it home, opened it up on my home computer, and with the information from Epic at work, it was really easy to just kind of like plug in the info. All in all, I would say it takes like under an hour. It's really, really easy to use, and the benefits are awesome. I blasted it out to kind of any executive that I've ever come into contact with. I had my supervisor send it out. I am in a ED provider meeting once a month. I remind them of the benefits through the ROI calculator then. And I just keep bringing it up, and it's a good idea to every couple of months just kind of update it. If you don't have time to update it, there are 4 different graphs you can use, so it can still be new information. If it's like, maybe your supervisor says, hey, come in, pop in on this meeting and talk about the program for a little bit, you can just switch it out. So yeah, there's a lot of ways to use it. I don't feel like I can share it too much. So I also probably, if you have events kind of like how we all did Overdose Awareness Day, I know that I think August, or there's some summer month, I think, and it's Alcohol Awareness Month, right? So if you have a booth, then have the printout there, right? Because it's going to be hospital staff coming that you're interacting with. So I just show it to everyone as often as I can. And I've had really good results with it. My grant ended this month, and they pretty much said, like, don't worry about it, we're gonna keep you. And I think a big part of that is them being able to see, as like being a hospital, right, the financial benefit to having us there. So that's a big component for them. So if anyone has any questions, I'm happy to help you with it. It's really easy to use. I highly encourage everyone to use it. So thanks.
Thank you so much, Amanda, John, Latoya, Chaya. This was wonderful, and I hope our navigators have some questions, because you have some experts here right now to field your questions. Amanda, I was just so impressed when you talked about the return on investment tool calculator, and I have a question. How did you pick your patients, and how many did you pick for the calculator?
I used 5. I would say of the 5, there were 2 that I knew I was going to use, and the other 3 in my Excel spreadsheet, I keep everyone's like MRN name, all their info. And if it's the second time that I've met with them, I have their name in red text instead of black text. So I can kind of easily pick out, those names will stand out more so. And then you can I also just use Control F and I'll put in like John Doe under Control Find, and it'll say, you know, John Doe's name came up 16 times, right? And then I can put in like Bradley Cooper, and Bradley Cooper came up only 3 times, right? Like, so I can kind of, it's an easy way to see who have I seen the most, because it'll just tell you how many times that person is in that Excel spreadsheet.
Okay, thank you. Because I think some of our navigators are just overwhelmed with the first step, right? How do I get this data? I have a question that says, my hospital does not have Epic. Will it be as easy to gather the data needed for the calculator? Our data team, John, can you use this? Does it have to just be Epic?
It, no, I mean, it obviously depends on what EHR is at your hospital. I think if you want to consider how you're already collecting your data, and yeah, I mean, the same metrics apply whether it's Epic or Cerner or whatever sort of EHR you're using. I think it sounds like Amanda, has a great example of sort of internal spreadsheet, maybe even separate from Epic, that she maintains. And like, I would definitely recommend that if you don't already have that set up. But if not, you might need to work closely with whichever EHR specialist is at your hospital to sort of identify and pull the best cases for your calculator, for the inputs for your calculator. And so we can kind of talk through that maybe, in the data email, or we can set another time to kind of give some tips on that. But it definitely doesn't have to be Epic specific. Whatever EHR you use, you'll be able to pull that information typically.
Oh, thank you. Thank you. I just, we want to make it super easy. And I know we have another person, we don't have Epic. And again, there's other ways to collect the data, even if on you have a different EHR system. Definitely talk to your IT and see what numbers you can pull, and talk with your supervisor, because there's somehow somebody's tracking all of the patients that you're seeing. So definitely, and the ones who keep coming in, and maybe it's somebody like Amanda said that you haven't seen in a while. That you're actively working with. That's a good start. I'm going to steal her answer is somebody that you have not seen in a while, that you were working with a lot before. That's your first step. There's another person on here that says something about her numbers don't get along. Do you need to know about numbers, John, with this tool?
Sorry, well, the question was, do you need to be like good with numbers or like really comfortable with them? Okay, sorry, my video's acting up. No, I mean, you have to be able to find the right numbers. And I think once you go through it once, usually with one patient and looking through the EHR closely, you'll quickly get the swing of which numbers and which things you're looking for. And it's pretty straightforward after that. I usually say usually the first one is always kind of the most challenging one to identify, but then honestly, once you figure that out, you'll be set up for however many other patients you want to include in the calculator. And if you have questions, about, are you looking at this right? Or is there a better way or different way to look at this? Feel free to reach out to us and we can help clarify that.
Thank you. Such great questions and great answers. Like I said, we have the subject matter experts here with us now. I have another comment. This is, I keep my own data each month on patients. Excellent strategy. I cannot, even give you more kudos for that, because you can actually filter your own list and find out for those repeat patients and things like that. So it is definitely, you could look for the recurring, Latoya put in there, names or MRN. So if you're already, keeping your own data, I really like that. I don't see Alina on here with a hand raised. I'm sorry. I don't. Lena, you have your hand raised. Can you unmute yourself? Lena, are you there? Okay, I'm not sure. Give her a second. Lena, if you're there, you can unmute yourself and ask a question. All right, and then Amanda has put in the chat, I also add that you can have major results with even one patient who had a long patient stay. She had one patient that was there for 970 hours, and 970 hours were saved from inpatient simply based off his one admittance. Absolutely, Amanda. Great point, because how many times a patient comes in and they may not be truthful of why they're there, and the doctor's running a bunch of different tests and x-rays and labs and all of that stuff. And if they get it right the first time, that patient can be out in a few hours versus 970 hours. So great point, Amanda. Like I said, we have the subject matter experts. So again, if you think of a question, put it in the chat. I'm going to finish up here. If there's no more questions, you guys, come on. I know somebody, don't be afraid to think of it. It's okay. Any final words from Chaya or Latoya or John?
I just think that all of our navigators are fantastic. To be super corny, which most of you might know me as being corny, but I just think you're the bee's knees. So use this stuff to advocate for your role, because each one of you is is worth advocating for, worth showcasing your impact. And I think that it'll be super easy. It might take a little bit of time with the preparation, but it'll be really easy for you to just have that conversation. And it doesn't have to be in person in presentation, like Amanda shared. It was something in written format that she spread the word and did her pitch that way. So be creative and do whatever works for you, but advocate and share your impact.
I love that. Thank you, Latoya. And I just want to say you guys did an amazing job today. I feel like our navigators can go out there. Come on, you gave them the confidence. And, again, just try one. There's no wrong way, right, John? If they put in the wrong numbers, it's okay. It's not going to mess anything up, correct? Yes?
Exactly. Just try it out, and if you want anyone to try it, that's why we're here.
Absolutely. So just try it. I know there's people saying they're afraid of, putting it in the calculator. Just try it. Even use fake numbers just to learn how to use it. Remember that? Just be creative. Just use a fake number and see, how does this work? And that way it'll get easier the more and more you use it. So I just want to thank our guests today. You guys did an amazing job. I know you gave out great information for them to get started in promoting your program. And definitely I challenge our navigator team, challenge you to increase your impact. Really go out there and strut your stuff, tell your numbers. You're doing amazing work. As Latoya said, you guys are working it and killing it out there with getting referrals and changing the culture. So please, I definitely implore you to just take those steps, increase your impact. We're going to finish up here. If there's no more questions, you guys are quite a bunch then today. All right. So all of our trainings are available on CA Bridge Academy. If you don't know about it, now you know. It's on our website, and it's a great tool. If you missed one of our trainings, you can go on there, and it is completely free. And actually, you can refer your doctors and your nurses. There's CMEs and CEUs for everyone. If you have any questions for us at the Navigator team, we have mentors at cabridge.org that will go to all of your favorite mentors. They're here today on some of them are still working, as you know, but these are your Navigator mentor team, and we are really excited if you're going to be joining us in LA. If not, we're going to see you in October, and I am always here to help and support you. That is my contact information. Anything else before we end? We have a few minutes, 4 minutes. That's okay if we end early. I will stick around for a few more minutes. Thank you, everybody, for attending. Bye.